Next up, I have the honor of introducing my colleague again, Irene Davis, the Nevada coordinator for RAPM, and leads both the CBURN group focus group for RAPM and also for the PPN, along with their position leads. And is also the retired Clark County, Nevada Assistant Emergency Manager. And I'm just going to toss it over to you, Irene. Just let me know when you want the slides advanced.
Thank you so much, David, for that introduction. And I have a very brief presentation to make you aware of some chemical safety and control measures that you'll be hearing details about today, and some training opportunities related to those. So David, if we could go to the next slide. I'm going to cover safety and control measures and training with just a little bit of an overview with regard to RAPM and PPN CBURN, the areas that we focus on. I'm gonna show you some resources related to healthcare coalitions that those representing healthcare coalitions can take advantage of through your respective communities and states. Some safety and control pediatric response considerations, trainings available for those, and additional training resources. So I'm going to talk about some things that you might encounter at the facility level, the local level, the regional level, state. And if you're affiliated with a tribal entity, we have some resources available through the various federal agencies as well. So in both RAPM and PPN, the CBURN groups, we actually meet jointly on a monthly basis. And our areas of focus include preparedness in terms of planning, training, and exercise, providing resources and working on our own preparedness. We provide resources in terms of building partnerships and work to build our coalition of CBURN subject matter experts and the federal, state, local, and tribal partnerships that we're working on, as well as the private sector as appropriate. We also do quite a bit of outreach and information sharing before, during, and after related events. We have this, for example, during COVID, we developed a number of fact sheets to help folks understand the rollout of the COVID vaccine. And we have also partnered with the infectious disease folks who also work in RAPM and PPN to develop outreach materials. And as I mentioned, building our cadre of subject matter expertise. We're a very multidisciplinary couple of groups. And we work together as much as possible to leverage all of those great resources that we have around the table. Next slide. To help folks understand the HPP annexes and plans, healthcare coalitions are very multidisciplinary. There's emergency management, there's first responders, there's hospital representation, public health representation, and all of those groups may have their own plan within their own organization. And the key is, how do they align with the bigger picture? And the Healthcare Coalition Chemical Emergency Surge Annex template that is available through ASPR on their website, and I have the web address down below, gives you that bigger picture idea of considerations and required core elements that should be in each of the plans and annexes. And the trick is, between all of these different levels of organization, to make sure that you have plans that are aligned and that you're not leaving any capability or capacity gaps in the development of those plans. What we would like to emphasize is, even though you might have a chemical response surge plan or chemical response plan or hazardous materials response plan, whatever it's called in your jurisdiction, does that plan focus enough on pediatric considerations that you're going to be hearing about in today's workshop? So that's just something to take a look at. It may be a gap for you. It may be something that you fleshed out quite well, or you may have participated in a pediatric surge plan overall, and there's a chemical component to that. So just take a look and see where chemical response fits in and make sure you have it adequately covered. What's really important is to make sure you identify the roles and responsibilities in that initial response, whether it's first responders, first receivers at hospitals. It could be fire, EMS, police. Every agency that's involved in response has their specific area of responsibility. And again, this planning effort is to make sure everyone understands that role has been practiced and tested, and everybody's clear what they're supposed to be doing at the scene and thereafter. In terms of coordination and notification, in that initial response, recovery, oftentimes that role is at hospitals, Office of Emergency it could be fire, EMS, at the state level, or the local or tribal level. And so just make sure everyone is aware who does what in terms of coordination and notification. So as you're putting out important direction to the public, or to your patients, that you know who's supposed to be doing what, and that you're not leaving any in terms of gaps in coordination, notification, public notification, public in that initial response, like that. Whether also looking at surge capacity and potential contingencies. It could be fire, EMS. Again, you may have addressed that in another plan, emergency operations plan, or a crisis standards of care plan. Just make sure your plan for chem aligns with those previous efforts and existing plans. In terms of addressing what the capabilities and resources and subject matter experts are, you may not fully understand what chemical you're dealing with, or what the agent is that you're dealing looking with. At surge capacity in that particular incident. Really important. So you want to make sure that again you may have addressed that in a with other partners in your community to understand what response and recovery capabilities you have, what resources you have at your disposal, and what subject matter experts you need to call in terms of address effectively respond to that incident and treat your patients. The other piece of that is identifying response and recovery tools, whether it's an important piece, or again, you may have addressed that in a mentioned the decon checklist, or a mental health tool assessment, or an app, or anything like that, whether it's for your patients or for your employees within your facility. Next, safety and control measures. Make sure your plan addresses operational, occupational safety for both responders and receivers. Dr. Hussein did a great job talking about PPE, so make sure that your plan addresses how to acquire that PPE, how to use that PPE, and then it's subsequently practiced. Field and hospital patient safety, of course, the decontamination process, space and supplies, countermeasures and related supplies, and the safety and control measures coordination with federal, state, local, tribal agencies. For example, if you are in a community that has a local office for EPA, or for Department of Energy, or for Department of Transportation, or the Federal Railway Administration, subsequently practiced. Agencies field and hospital patient safety, of course, the decontamination process, space and supplies. Make sure that you have those relationship built already, and that roles and responsibilities for those agencies are built into your plan. And then, of course, make sure you have a system of effective public information and warning, that your public information officers are involved in your planning process, that you're coordinated in terms of federal, state, local communications, and make sure that you have a piece of that already articulated in your plan, so you have good direction going into the event. Next. And then I've laid out here some resources that may be available. These could be free resources depending on the agency, or they could be available through grant funding. Planning, training, exercise equipment, and supplies are oftentimes covered by state emergency management agencies or local emergency management agencies, particularly at the county level. So if your state, I think all 50 states have these state emergency response commissions that are established under a federal act that requires community right to know. And that State Emergency Response Commission handles everything hazmat, preparedness, response, and recovery, and do provide periodic funding depending on your process within your state to be able to support for those activities in preparedness, response, and recovery, and also mitigation. Local emergency planning committees are the county subset of the State Emergency Response Commission. Typically, every county or every region within a state has its own local emergency planning committee. So make sure you know where yours is located and who the contact people are there to help you get some of that free training or grant funded training. State and local emergency management agencies, as I mentioned, those are integral and very key and very important to be able to support your facility, your region, your healthcare coalition. They're usually a prominent partner in those groups. And so make sure that you leverage the resources that they already have. Every region within a state has its federal partners in your community, as I mentioned. For example, the FAA requires airports to do exercises every 3 years that include a hazardous materials component. So that's an opportunity that you can leverage or participate in. The EPA, Department of Defense, Department of Energy, Federal Railway Administration, US DOT, Department of Homeland Security, and specifically FEMA all have training programs and training classes in place. They can either be done online, and sometimes you can make arrangements for them to come into your community or your facility or your region to provide that level of training depending on your needs once you've done an assessment of where your gaps are. And most of those are for free, but there are also, for example, through Department of Homeland Security and FEMA, opportunities to apply for grant funding, again, to develop plans, update plans, provide training opportunities, coordinate and exercise all types of exercises, and also to purchase supplies and equipment and to further educate yourselves through attendance at conferences. So many opportunities, too many to list in a few PowerPoint slides, but all of those agencies have clear links to their training and exercise opportunities. And then if you have any questions or need additional information on those resources, please contact me. Make sure that you are well connected to your state and county sources. If you haven't already done so, introduce yourselves and find out what their training schedules are. Each of those organizations are required to do an annual planning, training, and exercise calendar. And so you can easily connect through those venues. Thank you so very much. And if you have any questions that you want to put in the Q&A, happy to answer them.
All right.